Hello, hello, my dear friends. Do you hear me? Today, we are going to speak about rosacea. I'm sorry I close my photo and speak with you and demonstrate your my presentation.
So let's start. Clinical picture and differential diagnosis of rosacea. Expertise, practice, care, and key points. What is rosacea? Rosacea is a chronic inflammatory dermatosis characterized by skin lesions in the form of erythema and papulopustular elements, phemas, as well as eye lesions. Rosacea is an Agenerosis localized mainly in the innervation zone of the trigeminal nerve and caused by various causes that can be combined into the following groups: vascular disorders, changes in the dermal connective tissue, microorganisms, digestive tract dysfunction, immune disorders, changes in the sebaceous system, oxidative stress, climatic factors, and phytovegetative disorders. At present, it is believed what number of factors influence the disease development. Exogenous, elementary, alcohol, hot, spicy food, solar radiation, wind, high and low temperature, intense physical activity, emotional stress, some cosmetics, prolonged use of steroid ointments. And second one, endogenous, demotex, folliculorum, mites, gastrointestinal, endocrine and nervous system disorders, immune status changes. This disease has been known at least since the Roman Empire under various other conditions such as sunburns. Rosacea affects the persons of both sexes 30 to 50 years old, commonly women, with a certain genetic predisposition of transient redness of the face skin and less often neck and décolleté. The persons of phototype 1 and 2 and so-called Celtic tides are more susceptible to dermatitis, but the disease may affect any skin phototype. In European countries, the incidence of rosacea ranges of average from 1.5 to 10%. Studies show prevalence of rosacea in the USA and Europe ranging from 2.2 to 22%. Why do people have rosacea and others don't? Typical environmental factors, usually harmless to people with heavy skin, can lead to rosacea or its aggravation. In a study conducted in the USA, the following provocative factors were noted. First one, exposure to sunlight, 81%. Second, emotional stress, 79%. Hot weather, 57%. Alcohol, 52%. Rosacea, a set of predisposition factors. People with sensitive skin development and neurogenetic reactions, disturbed skin barrier, production of pro-inflammatory peptides. All the following symptoms that develop: soreness, burning, itching, tingling, dryness, and skin tightness. Rosacea photogenesis. It presents Rosacea presents difficult immunological processes. Characteristics of the main rosacea clinical manifestations, which present relation to the effect of provoking factors, preventional location in the central part of the face, amplification by tides, and the duration of transient erythema is very important. So, what about tides? There are a number of tides. Reparative episodes of transient erythema, 5.5 times per week on average, with an average duration of 1 hour. It is accompanied by unpleasant sensations of burning and tingling in the foci. Patients call transient erythema the most disturbing symptom. It has the same clinical, historical characteristics and development features as the neurogenetic inflammation caused by capsaicin, including sustainable vascular expansion, swelling in the superficial dermis layer, like acid infiltration. It is all formally known as pre-rosacea. Persistent erythema consists of an important diagnostic sign of rosacea. The color is bright pink to blue-red, and localization is in the central part of the face. The duration is more than 3 months. Telangiectasia is the result of neoangiogenesis. It may not be present in the clinical picture. Papules and pustles. They are located in the background of erythema. The color is bright. The localization is pervascular. Flaking on the surface is usually absent. The location is perinasal, perivascular, and perioral. Farmers are typically for men. Significant thickening of the skin tissue and uneven bumpiness of the skin surface. There are 4 types. First one, rhinothema. Second one, gnatothema. Third one, metothema. And the last one is autothema. Rosacea classifications have 4 subtypes. They are first subtype, erymato-telangiectatic, 64%. Second one, papulopustular, 36%. Third one, rheumatous, 24%. And ophthalmorosacea, 36%. Rosacea classification includes overlapping subtypes. However, patients often have an overlap of different manifestations, which means that there is more than one subtype of the disease. Patient with 3 rosacea subtype, moderate subtype 1, subtype 2, and moderate ophthalmorosacea subtype 4. Papulopustular rosacea subtype include persistent background erythema and inflammatory lesions with erythema around. Erythemato-telangiectatic rosacea subtype, persistent erythema, vascular regulation, permanent vascular expansion, and neoangiogenesis. Phimosis rosacea subtype and ophthalmorosacea. Phimosis rosacea subtype. It's often found after or in combination with subtype 1 and 2 ophthalmorosacea. Skin symptoms are not prerequisite for diagnostics. Rosacea clinical picture. Mild and severe degree of papulopustular subtype. A. Mild PPMR degree, and second one, severe PPR degree. Emotional and physico-social burden of rosacea. Studies conducted in patients with dermatosis by National Society for Rosacea in the USA showed the following results. 56% don't experience pleasure and happiness in life. 88% believes that the disease had a negative impact on their professional life, and 41% avoided social and public contacts. Differential rosacea diagnostics. Differential rosacea diagnostics is conducted in the following disease: vulgar acne, seborrheic dermatitis, perioral dermatitis, disease of connective tissue, steroid dermatitis, contract dermatitis, including photodermatitis. Which diagnosis? Rosacea or acne? Rosacea. It's erythema, telangiectasia, papules, pustules, and localization centrofacial. Acne. White heads, papules, pustules, acne tarda, location, lateral surface, mandible area. Vulgar acne include retention damage, microsites, and open comedones. Acne pathophysiology, dysboria, oily skin. They manifest in adolescent seborrhea. There is no centrofacial localization, white heads, papules, and pustules with erythema whisk at the periphery. There may be nodal elements ending up in scars, no telangiectasia. The photo there is clinical picture of rosacea and acne. Seborrheic dermatitis. It usually affects men. It's foci allocated at the top of the head, face, ears, and upper torso. Erythema is red with a yellowish hue with grassy flakes on the surface. Seasonality is improvement in the summer period. Related pathology, gastrointestinal disease, neurocystis, depression, and HIV infection. Perioral or steroid dermatitis. Perioral location, small papules, papular vessels, and rarely papular pustules on diffusely inflamed erythematous skin. Cosmetics and the external application of glucocorticosteroids have the greatest importance in the perioral dermatitis development. A typical picture of rosacea: central facial rash, localized and dry sensitive fragile skin. Polymorphic photodermatosis. Past medical history: a clear relationship between exposure to sunlight and the appearance of efflorescence on the skin. Um, Abnormalities have seasonality, with remissions in winter. After staying in the sun, there is an itch, burning, tingling, and erythematous papular vascular rashes and exudation. Red lupus. Localization of hot spots or in photosensitive areas. They are cardinal signs: erythema, follicular hypercorticosteroids, atrophy. Hot spot localization. Face, red ending on the lips, upper part of the head, upper third on the cheeks, back sides of hands, and special laboratory tests. Discoid red lupus. Erythema. Pink and red peeling plaques on the face, butterfly-shaped, chest and back at the edge of the foreskin. Follicular hypercorticosterosis. Small asbestos scales of the plaques. When removed, they reveal shark spirals, a lady heel symptom, painful removal of scales. Benjamin-Shersky symptom. Scar trophy. There are three zones in the foreskin: scarred in the center, infiltration hyperkeratotic, and erythematous with peripheral atrophy. Back diffuse infiltration sarcoid. It is characterized by the formation of plaques on the skin of the face, usually on the cheeks, nose, and less often on the torso, in the form of the flat infiltration plaque of purple-pink color with a diameter of 5 or 6 cm or more. The dust phenomenon is positive. Dermatositis, affection of periorbital region, persistent swelling, availability of mesocytes. Positive muscle enzyme test KFC, electromyography, muscle biopsy, detection have some special antibodies. International clinic guidelines for rosacea patient management is ROSCO. It includes new method of treatment, ivermectin and brimonidine. Pay attention to additional measures: identification and elimination of provoking factors, the use of sunscreen and moisturizing dermatocosmetics agents. Global consensus on rosacea diagnostics and treatment. To achieve sustainable clinical effect, rosacea drugs should be selected for the patient individually, taking into account the clinical picture. If several clinical manifestations of the disease are combined, the therapy should include more than one drug, as well as daily skin care and phototherapy procedures. Daily skin care. A limitation of reduction trigger factors. Application of sun protection with SPF 30+. The use of cleansing and moisturizing dermatocosmetics specially designed for the sensitive skin of the rosacea patients. Modern combined external therapy for rosacea, Mirvaso and cilantro association in the treatment of the moderate to severe rosacea. A study which proved the efficacy and safety of 1% ivermectin cream and brimonidine tartrate. What is due of treatment in treatment of rosacea? Inflammatory elements due to congenital immune response activation: cilantro, anti-inflammatory and antiparasitic agent, 1% ivermectin cream for topical application. Daily care for sensitive skin: cleansing, moisturizing, and sunscreen cosmetics, transient and persistent erythema due to expansion of small dermis vessels, Mirvaso. It is a gel for topical application. Apply once a day in the morning. Mosaic are products for compulsory daily skin care. First one is cleansing plus moisturizing Cetaphil. Use in the morning and evening as a face cleanse to prepare the skin for the product application. In the morning, brimonidine gel, and in the evening, ivermectin cream. Treatment. And third one is moisturizing plus photo protection. Cetaphil moisturizing protective cream. Apply within 1 hour after applying brimonidine gel in the morning and especially 31 days of high activity on the street. Clinical example of medium gravity PPR, cilantro cream once a day in the evening and doxycycline before after 3 months of treatment, plus Cetaphil Pro line for skin with rosacea. It is recommended. Continue applying cilantro cream 1% ivermectin once a day in the evening until clean skin is achieved. Daily care for sensitive skin, Cetaphil Pro range. Further skin redimerization produced. Fundamental principles for successful management of rosacea patients. A limitation or reduction of the factors contributing to rosacea. Daily care for sensitive skin with rosacea. Use of cleansing and moisturizing dermatocosmetics agents. Application of sun protection produced with SPF 30 till 50 plus. The treatment of rosacea should be selected individually and based on the disease clinical picture. Medicines with proven efficacy and good safety profile, which allows using them as long-term maintenance therapy. So friends, pay attention here. Nowadays, we have a new innovation method of transdermal redermalization options for rosacea treatment. Rehab for rosacea. Transdermal redermalization as a component of rosacea treatment support with proven efficacy and safety, which include microcirculation improvement, creation of an optional physiological environment for skin chaos, stimulation of reparative processes, restoration of skin hydrobalance, skin oxygenation, and chasing the agency cell potential, prevention of hyperpigmentation, anti-inflammatory effect, restoration of fibroblast activity, stimulation of elasticity. Redermalization is a proven improvement in skin quality by restoring its regenerative potential. Includes hyaluronic acid, 11, 18 to 22 mg or millimeter unstability, molecular mass 2 and 5 billion Da, sodium succinate 16 mg or millimeters, pH 7.4. Form of issue, pre-filled syringes 1 and 2 millimeter. Double synergic effect technology, sodium succinate, intracellular metabolite, the most important member of the Krebs cycle, which is contained in all organs and tissues. Hyaluronic acid, high molecular weight. It is a natural component of the cellular and matrix structures in the human body. Sodium succinate, mode of action. Intracellular action, Krebs cycle. It actively affects the fibroblast mitochondria, provides powerful cellular repair, stimulates the energy production in cell. It has a powerful antioxidant effect, prevents damage to cell membranes, prevents damage to cell genome. And extracellular action receptors stimulates the synthesis of collagen and elastin, actively affects the synthesis of endogenous growth factors, increase the oxygen delivery to skin, improves microcirculation and lymph flow, processes depigmentating properties, block telomerase synthesis. Conclusion. Hyalual significantly increase the proliferation of fibroblasts, the dermesis, as compared to saline, dry injection, and HA. Conclusion. Hyalual restores the microcirculation channel function. So, clinical case analysis. Clinical case number 1. Patient 1, 41 years old. Face rashes accompanied by burning and itching. Related disease, chronic gastritis. Medical history, sick for 5 years. Exacerbation in the background of straight inhalation with especially severe condition during pregnancy. Um, Depression due to skin disease. Systematic therapy. Metronidazole 250 mg 1 pill 3 times a day for 3 weeks. Doxycycline 100 mg 2 pills for 4 weeks. Topical metronidazole 1% cream. Pimecrolimus 1% cream wasn't effective enough. There was improvement, but at least 15 inflammatory elements have always remained. Redermalization results after or before and after. After the first treatment. Clinical case number 2. Patient, 56 years old. Face rashes accompanied by burning and itching. It was sick for 5 years, exacerbation in the background of stress, insolation, and after thermal exposure. Prevision treatment, systemic therapy, doxycycline, minocycline, and metronidazole. Topical, azelaic acid, dilacin cream, 1% metronidazole cream showed short-term improvement. A redermalization result. Hyalual 1.1% 2 mg before and after. Long-term therapy for rosacea. Patient reserving cilantro treatment for 10 months, followed by the redermalization cycle intentional level. Redermalization result. Hyalual 1% 2 mg. Redermalization. Skin moisturizing and elasticity. And elasticity. Humanity. Before using the drug, I end. One second. Redermalization from the point of view of evidence-based medicine. Confocal scanning laser microscopy. The picture taken before the redermalization shows a horizontally placed, considerably extended vessel. After treatment, there is a pronounced narrowing of the previously dilated vessels, both of smallest and the largest ones, including in the dermal papillae. The overall structure of the upper dermis has a more homogeneous appearance with normal arrangement of the fibers and vessels. What about home care? Gentle skin cleansing, selection of products taking into account the skin sensitivity. Avoid the exfoliates, scrubs, peelings, solar protection products 30 till 50 SPF, moisturizing agents, Hyalual cosmetic procedures to restore skin after treatment with pharmacological topical products. Home care. Transforming melting cleanser. Function. Dissolves makeup, removes microparticles of dirt and cleans pores, moisturizes and improves skin structure, smoothes and soothes the skin, restores the skin, enhancing the skin's protective function. Used in the morning and in the evening. Apply to dry skin without period wetting. Then wet your fingertips with water and massage in the circular motion until liquid emulsion is produced. Ingredients: hyaluronic acid, retinol, vitamin E, allantoin, provitamin B5, bisabolol, super serum. Deeply and permanently moisturizes the skin, enriched with collagen, improves elasticity, restores the skin, prevents photoaging, firms the skin and corrects wrinkles. Apply to cleansed face, under eyes, on the neck and décolleté area. Hyaluronic acid multimolecular complex, peptides, collagen, tripeptide 5, provitamin B5. Powerful routine oil. Reduces the visibility of pores and small folds, improves skin elasticity, improves the texture, moisturizes and nourishes the skin, combats the sign of aging, and the photo aging. Used in the morning and in the evening. Next generation granactive retinoid, next generation retinol, algae extract, 15 target oils, patented raspberry stem cells. C illuminating 3D moisturizer. Instantly gives a radiant effect to the skin, firms and tightens the skin, lightens the skin, smoothes the skin, deeply moisturizes and combats with pigmentation. Apply to cleansed face, neck and décolleté. Vitamin C, a hyaluronic acid multimolecular complex, tripeptide first, probiotics, beet extract, shea butter, almond oil, jojoba oil, um, vitamin E, vitamin B5, polysaccharides. Hydrofusion, deeply and permanently moisturize the skin, restores skin elasticity and reduced wrinkles, lightness and smoothes the skin, narrows and pores, soothes skin and reduces redness. Apply 2 times a day to cleansed face, neck, and décolleté. Um, Multimolecular hyaluronic acid, aloe vera, provitamin B5, jojoba either, tripeptide, apricot oil, vitamin E, elantoin, ATP complex, algin and papaya extract, squalane. Next is flawless skin mask. Tightens the skin, increases skin elasticity and tone, antioxidant effect, narrows the pores, corrects wrinkles, and improves skin texture. Apply the mask to a cleansed dry face. Leave the mask for 20 or 30 minutes. Collagen matrix, ethylene rose cell extract, um, homolamile, purslane extract, and transdermal transmission technology. And the last one is Flawless Hydra Mist. It provides long-lasting, intensive moisturizing, protects the skin from polluted air, relieves from dryness and tiredness, relieves inflammation and soothes, increases skin elasticity and softness, stabilizes the protective barrier, stimulates natural exfoliation. Spray from the disease distance between 25 or 30 centimeters. Hyaluronic acid, aloe vera, polycartids, provitamin B5, elantoin. Thank you for your attention, my dear friends, pushing the boundaries in rosacea therapy.